The two things that we will do, one slide on morality and healthcare, 2 slides on cooperating with evil. You need not write this down, but I want to show you what's coming up ahead the next 2 days. Because my experience in doing this is people like talking about the examples. When I use an example, say for cooperating with evil, on abortion or euthanasia, it's not the time to talk about abortion and euthanasia, all right? It's a time just to use the examples to explain the principles that I'm trying to get across to you. So we will talk a little bit about medical research, a little bit about organ donation, principle of double effect. That's when sometimes, something bad's going to come out of the surgery. Do we do it anyway? Fertility assistance like in vitro fertilization, artificial insemination, things that are known as like gift, gamete, intrafallopian transfers and such. End-of-life issues, euthanasia, living wills, advanced directives. And it's going to be just like a couple sentences. And then about suffering and death, and what part does it play in our understanding of health care. All right? You're getting 3 days of bioethics. I need you to know how vast this field is. It's a course that should be taught here. There's no doubt of that, all right? Even I'm not certified in bioethics. I didn't have the money to complete the certification. But the man who did teach me, he's no lightweight intellectually. He did his PhD in neuroscience at Yale and his postdoctoral work at Harvard. Okay, there's a lot behind this. Oftentimes when we get into topics like this, you're almost getting the answer. You're not seeing the work that came into developing that. So sometimes it's not convincing, and I understand that. But always just have enough humility to think, what here am I not understanding yet? Because there's only so much we can go over at this level, to be honest. It's just really touching base on a few points is all we're going to have the ability to do. All right. With that little intro said, first of all, bioethics is a field in Catholic morality. It's based on natural law, but in light of divine revelation, okay? So it's based on natural law, but in light of divine revelation. It is not a Bible-only topic. I really don't know how you can do this adequately without understanding natural law, which already I expressed to you is foundational for Catholic morality. So we take natural law, but it's always in light of divine revelation. Now, there's nothing really to write down here. I just want you to know what that means. When I talk about a document, and that's what that is, the ethical and religious directives, from here on out, I'll just refer to it as the ERDs. All right? It just makes it easier to go on. The ERDs have 3 particular goals. And they may seem so simple that they hardly are worth mentioning, but we'll see as we go that they're foundational and often not followed. First of all, the ERDs say healthcare must affirm ethical standards that flow from human dignity. Okay? The ethical standards that are based in the ERDs must flow from human dignity. That simple sentence says 2 things that are very important. It says that, 1, there's a human nature, and you have to know what that is. So if you don't start out by asking what is a human person, you really can't do ethics, or you will not do it well or consistently. So it's an ethical standard that flows from human dignity. It provides authoritative guidance on specific moral issues. It has to be specific. It provides authoritative guidance on specific moral issues. In other words, it's not easy to know what the right thing to do in a field that's constantly changing and has so many various circumstances. So the National Catholic Bioethics Center, among other organizations, offer free services for people that are experiencing ethical dilemmas in their health care. Okay? So, yes.
Can you repeat the second one?
Yeah, it provides authoritative guidance on specific moral issues. And the third one is, it provides professionals, patients, and families principles for making decisions. Let's put the phones away. All right. Provides professionals, patients, and families with principles for making decisions. In other words, that's the best you're going to be able to do. you'll see when we wind up this little section or module that living wills are going to be problematic because you can't foresee every circumstance, right? So there's guidelines that are based on principles, and then they have to be applied to the specific circumstances of whatever is going on. Yes, dear? Oh, I thought you had your hand up, sorry. Just one point before we move on. Access to basic health care, according to the Catholic Church, is a fundamental right. Now, what comes after that, my little ellipse, dot, 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 it's just an explanation. It's not a privilege, right? Health care is not a privilege for some. It's a fundamental right. Do not think the Catholic Church endorses any one particular health care plan. They just don't. They could be almost indifferent. So before somebody thinks, well, they must approve of the Obamacare or the Affordable Health Care Act, as it's properly called, or they're against it, that's not the point. The point is that, how well does it suit? Also, the reason why they say that it's a fundamental right is because without good health care, a person can't even physically mature or psychologically mature. So this is important for human flourishing, all right? So it's not just a privilege for some. And we'll get into delineating that a little bit as we go. Now, these are just bullet points on the ERDs, just so you can see and know something about it. First of all, health care must address the whole human person, respect and protect dignity. I don't know if anybody here has had any serious health issues that you needed, various specialists. But what happens is they don't often communicate. And if one's treating diabetes and another one's, treating a lung infection and another one's treating some other ailment, what is the best approach for one may not be the best approach for all. It may not even be psychologically good for the individual depending on their age. So the whole human person has to be involved. What this is a collaborative effort, right? So it's talking about bringing the individual, the patient, in to the understanding of what's happening with their care. But nonetheless, it starts out by we have to protect the dignity of this person first and foremost. All the treatment decisions have to be in light of informed consent. The doctor is the expert. But it's not just up to him to make the call. He has to bring the patient on board, all right? Because the patient has to participate in what's happening to him or her. How do they want their health to go? I mean, you'll see later on that, we'll talk even here, that there's certain care that you can legitimately deny and not consider it committing like suicide or harming your body. And we call that disproportionate care. And we're going to talk about that at length tomorrow, but you can do away with disproportionate care. It could be, that look, I'm 72, I found out that I have cancer, not a great prognosis, I'd rather not go through all the treatments. That's not suicide. That's a person accepting the finality of their life. It could be a 42-year-old that's just tired of being in dialysis. Stopping dialysis treatment and knowing what's going to happen is not suicide. So there's a lot of decisions that got to go into disproportionate care. We'll talk about that separately. Tissue and organ donation, an absolute good. The church says do it. We'll talk about live donations like parts of your liver, a kidney, blood. I know it's not an organ, but still donating blood. And then once you die, you're not going to need your corneas. You're not going to need your heart. Offer those things. So we'll talk about more of that later. But the ERDs address this too. We will talk about prenatal fertility treatments. What is permissible for prenatal treatments? How invasive can we be? As far as fertility, is it anything goes? They can't have children. Can we do anything that science has to offer? Well, no. Because remember, science always asks, can we do it? Ethics starts out with what should we do? What ought we do? Euthanasia, under no circumstances. We can't talk about it now, but we'll talk about active and passive euthanasia, voluntary and involuntary. And if, by the way, you don't think involuntary, passive, and active euthanasia goes on in this world, you have simply never read any literature on the subject, all right? Preparation for death. That's part of the healthcare system. There comes a time where, the inevitable is there. The finitude of life is obvious, and healthcare system has to apply. And it's a lot different now, right? I mean, I don't know, has anybody been in a hospice? I don't mean you were there, but with other family members. Yeah, I mean, it's a nice way for a person to leave this world. It's not clinical. It's not, you know, some sterile atmosphere. It's like a house, but you have care of nurses there. I mean, what are they picking up on? They're picking up on, this is important, okay? This is important for the person in the last few days to go out with dignity. The last two slides, we're going to be talking about what's known as cooperating with evil. We have to avoid scandal, okay? We have to avoid scandal. And what I'll try to make the case is there's very little you can do sometimes to cooperate with evil. If you go to, and I'm not picking on Hot Topic, it's just it's one of my kids would stop in. If you go to Hot Topic and buy a T-shirt there, are you cooperating with evil? Could be. Where is it made? Under what conditions was it made? If your family owns stock, who do they own stock in? What does that company do to their employees? How do they treat their women? You can go on and on, you know. If you work in a bank, what if you make speculative loans? Or if you're selling, say, franchises, simply because the person agrees to buy it and you know financially this is going to kill them, do you do it? I mean, you're going to be making these decisions throughout your life. And again, if you don't think that this applies to you, I don't know, you're not thinking. I mean, there's no other way to say it, right?
Okay, you know the plot line of Breaking Bad?
No, I've never seen it.
Okay, well, like, he can't afford cancer treatment, so he starts cooking meth. I like.
Jesus.
But like that's
Great
like.
show, great show.
I mean,
It is
like,
a great show.
like,
So what's your question?
Like a newborn baby, like is that like? Do you see that as, like?
What ethic would that fall under?
I don't know.
That's strictly utilitarian. That would be consequentialism to the T. In other words, are you willing to do evil the good may come of it? All right. Now, if you say yes, well then okay, then apply that elsewhere in life, and you'll like it as long as you're on the receiving end of it. But if it was your child that got hooked on meth because that guy's trying to raise money, you wouldn't like it as much. Right? So that's the problem. The consequentialist theories work for the people who are on the receiving end of the good. They're not on the people that are on the other end. But nonetheless.
Wow, what a show.
Yeah, I've heard of it, but I've never seen it.
Wow. Great show.
I try not to get interested in it because then I will watching it. Okay, now,
I heard it's good.
now let's just reiterate some things I said here, but in like little clearer bullet points. We have to live in the world. That's obvious. We are participating as individuals in a broad network of relations. There's no way around that. We are participating in a broad network of relations. Nobody lives in a bubble. I mean, unless you're like, did you see that commercial for we're settlers? You know, and the guys there, you know, okay, unless you are a settler that makes your own goat milk and your own dried meats and you absolutely have no contact with the outside world and you're living, you know, simply, maybe that type of person could say that, you know, we've stepped out of the world, but nonetheless, we live in a broad network of relations. So the car you drive, the size of it, what effect does that have on the environment? People are trying to make that argument now, but that's not being, you know, environmentally conscious. So all these things. So what we're saying is that our statement and our premise is that sometimes it's unavoidable circumstances of cooperating in the evil of others. But we're going to determine where do we draw the line. It's impossible sometimes to not cooperate in the evil of others. In other words, now, whether or not you agree abortion is right or wrong, I've made the claim that it's an absolute evil, all right? Would you work for one? Would you work for a company that provides, in other words, let's say that you work for a printer. You're a graphic artist, and they'd like you to design a logo for a white supremacist group, and then you guys would be running off brochures for them. Do you just say, it's my job? Or do you say, I'm not doing it? Ponzi schemes, you know, where you take the money from initial investors, and, you take the money from initial investors, you bring in more smaller investors, take their money and give it to the initial ones, and you keep paying off the ones that came in first from the monies of the people that came last until you run out of people, and then you kind of skip out of town before anybody catches you, right? So was it Bernanke was the big one. Is that his name? Madoff. Bernie Madoff. What did I get? I'm thinking of something else. Bernie Madoff. And actually, you know, I was a real distant victim of that, because the Redemptorist order that I go to church at, their founder is Alphonsus Liguori, who is the patron of moral theologians. So they said, we'll pay for your graduate work. So they gave me the money for the first class, and then Bernie Madoff hit them. They were part of that scheme, and they lost $130 million to Bernie Madoff. So I also lost my ability to go to graduate school on their dime. So that's how life works. My point is this: like, I have a friend who did telecommunications. I had friends who did telecommunications. He had to make a decision when he was sent to an abortion facility whether or not he was going to set the thing up there. You're going to make all these decisions throughout your life. That's what I said. If you don't think about any of that stuff, then you are a non-thinker. Everything in front of you, you're determining, will I cooperate with this? You know, and even the legal system understands that, right? I mean, if somebody, you know, steals something, if somebody stole an iPhone and said, here, hold it for me, you're going to make a decision right there, will I cooperate with this person's evil? And if I have to what level? Well, I'm not going to. You know, well, then we'll make it seem like you stole it. You can do whatever you want. The basic principle of morality is I will not do good, I will not do evil that good comes from it. Okay? Which would also, you know, talk about the that movie you said. Okay, so I have a graph at the end, like a tree graph, that's really going to be good for people that are visual. This, though, will explain it individually. There are two broad categories in cooperation with evil: formal and material. We'll talk about formal first. Formal cooperation with evil means that you share the intention. Now, you guys already had Aristotle's 4 causes last year in sacraments, so you should now be thinking formal and material, you know, elements of the change. Formal is you're participating a lot deeper than material. All right. So there are 2 branches of formal. The first one is explicit. Explicit formal cooperation means you are doing it for its own sake. You're in it because you think what you're doing is good. This would be, and I'm using abortion as an example because it's very clear and easy, right? So I'm not here to argue the ethics of this today. We've already done that too, by the way. So a doctor is performing an abortion, and he thinks it's a good thing. He is cooperating with evil, formal, explicit. Formal, explicit cooperation.
Well, does he necessarily think it's a good thing, or is he just doing his job?
Okay, hold on. This particular person thinks it's a good thing. That's what makes it formal, explicit.
So in an instance where he thinks it's a good thing?
If he's an abortion doctor or a nurse and he's doing it, he thinks it's a good thing that he's doing, right? Or if you're working in a computer, let's say that you're working in a printing outfit and you're doing material for racist, white supremacists, and you like the fact that you're doing it, this would be formal, explicit, okay? So they think what they're doing is good. Now, to address Gabby's question, if you're doing it for some other good, then it is implicit formal cooperation. This would be a doctor or a nurse who's performing the abortion, but they're primarily doing it for the income. They're primarily doing it for the health insurance. So yes, I will design the racist logo because I just figure it's my job and I need the money. Okay? That might reduce your culpability a little bit or not, but you're still formally cooperating. In other words, what you are doing, you share the intention of the evil act. It's just down here, you're doing it for some other good rather than for its own sake. So that's the distinction between explicit and implicit. One does it for its own sake, the other one does it for some other good that they see coming out of it. Okay? Material cooperation. How material is distinguished from formal is it does not share the intention. Okay? That doesn't get you out of the woods yet, though. There are 2 basic branches of material. One is immediate material, and that's how you read this. Immediate material. What you are doing is essential to the act. You may not share the intention. You may not even like the fact that you're there. But what you're doing is absolutely tied into what's happening. So just an example, it would be a nurse who's working in the room during the abortion. She's not the one or the doctor physically doing it, but she's operating the suction unit that's doing dismemberment and extraction. Okay? So what she is doing is essential. In other words, you don't think in terms of, well, if she didn't do it, somebody else would. Okay, we're talking about what that particular person's moral choice is. Would you do such a thing? Or would you say, no, I'm out of here. Okay, get somebody else to do it. I'm not involved. Because you always have the option. That's the one thing you can't forget. Let me just say something. You don't need to write this down, because I don't think we're going to have time to do it. C.S. Lewis, he wrote a wonderful book called Abolition of Man. And in one of the chapters, it's called Men Without Chest. And this kind of ties into the Solzhenitsyn exercise that you guys did. He says that today's men have big heads. Now, the intellect's in the head, the guttural here, and the virtue's in the heart. And he said they look like they have big heads, but he says it's an illusion. Their heads are no bigger than they ever were. Today, their chest is so small because they lack that virtue. He said, so because they have such small chests, their heads just look bigger. So what he says is we have a generation of men without chest. Okay? So what we're looking for here is people of virtue that make a stand. I will not do this. But you might lose your job. I understand that. I don't want to lose my job, but I can't do evil that good may come of it. In other words, wouldn't you want a politician like that? Is there one like that? I don't know. Okay. Anyway, just a little ad. So underneath immediate, there's two, and you'll see that. And by immediate, now I'm talking, this is non-essential, okay? What you are doing does have a direct influence, and it is ordered to the act, but it's not essential for what's happening. But it's still not a good cooperation. What would be an instance of this? Your friend is going to Planned Parenthood for an abortion. Can you give me a ride? I'm not giving you a ride to an abortion. Now, you might say, but if I don't give her a ride, she'll still get there. I understand that. This is about me cooperating with evil. This isn't about whether or not the evil act's still going to happen, right? So, if somebody was going to go rob a bank or a house, and they said, can you give me a ride? You're going to have to make a decision. Am I going to go involved? Hey, come on, we're going to go to a basketball game. We're going to make fun of this girl. Come on with me. I don't think so. Okay? I mean, even law understands this, right? If you did happen to drive somebody to a burglary, good luck telling the officer and the judge that all I did was drive. Okay?
How can you compare that to driving your friend to the Planned Parenthood?
Okay, so what you're doing, right? You're still directly influencing the evil action, and it's still ordered. I mean, what you're doing is you have the option to say no. Okay, now where this wouldn't be, let's say like you were a cab driver, right? And you were just dropping people off, and somebody says, can you give me a ride to Planned Parenthood? Yeah, you take them to Planned Parenthood. Why? Because that's not the only thing they do there. You don't know why they're there. Any more than if you were a cabbie dropping them off at a bank, how did you know they were going to rob it? But if somebody comes to you and says, in other words, they explain the evil act, I'm going to do this. And like I said, this isn't just, super evil things like abortion, murder, and burglary. It could be, ruining somebody's reputation. It could be mocking somebody. Whatever the evil action is, this is still a level of participation that is not necessary for you to do. All right? So it's non-essential. We get it. Right? This thing is good. You're not the person doing it, but you're still materially cooperating. And like I said, the law would understand this, right? Even the law would say if you drove somebody to a bank robbery, or if you drove somebody that they were going to get into a fight, you're still going to be culpable.
So, like, if you were a cab driver and you were driving somebody to Planned Parenthood, and halfway through the drive they mentioned, oh, it's like I'm going to an abortion.
What would I do? I'd pull over and I'd say, you need to get out. You need to get out. If that's what they told me they were doing. See, think of this. think if somebody, like, let's use a robbery, right? You see, the problem is here is people aren't all on the same page with what abortion is. Somebody's going to steal something. So all of a sudden, your friend comes and says, hey, can you give me a ride over to this guy's house? Yeah, I'm going that way. And you give him a ride. On the way, they tell you what they're going to do. Actually, when I get there, I've made, I have a spare key. I got it because I was dating the guy's daughter. And I'm going to go in there, wait till all of a sudden, I'm out. I got nothing to do with this. Get out of my car. It's the same thing, right? So you have to make decisions on what level will I participate in this, all right? Now, we can probably spend a lot of time determining what falls in there, right? Because it's not always very clear. You always have to use what's known as simple scenarios in this. When you're illustrating something, use a simple scenario. Because if we start adding circumstances, that will all change. There is one more. Remote media, okay? Remote media material cooperation has an indirect influence and is not ordered towards the act. This would be, I'm a nurse, I work on a wing of the hospital, and my job in the entire wing is to go through the rooms, check vitals, blood pressure, oxygen levels, you name it. And in some of those rooms, abortions occur, and some women are there for abortions. Where you're at is, it has no influence on the evil act, per se, directly. And nothing you're doing is ordered towards that. That role, compared to, say, the nurse who's using the suction unit, is an entirely different thing. Put the phones away. All right. Now, I'm a visual person. I need to see it laid out this way. So anytime, and again, pick anything where you might see that you're involved in anything, whether it be buying stock, whether it be buying clothing. I mean, you guys may not remember, but there's, Kathy Lee Gifford was on the Today Show. At one point, she was ostracized because they found out some of her clothing was made where there were child sweatshops. Okay? Now, whether or not she knew it or not isn't part of our discussion here today. But why would people have a problem with that? Because anybody then who bought that product knowing it was then supporting the method by which they made the product. That's how we have to think. Now, you're not an investigator. You can't go to Target, or as you like to say, Target, and get a box of anything and know the history of it. We understand that, okay? But if you should at least do due diligence, right? So if for some reason it was in the newspaper that this particular product is, made by, child labor in Indonesia, and Target sells it, now you know. Okay, now you have a decision to make. Gabby, do you have your hand up?
No.
All right. So what it breaks down to is formal material. Under formal, you have explicit where you're doing it for its own sake. You have implicit where you're doing it for some other good. You have material where you're not intending it. It's immediate if it's essential to the act. It's non-essential, we call it immediate. And then immediate breaks down into proximate and remote. According to Catholic moral, bioethics, or however you want to play this out, remote immediate material cooperation is the only licit form of cooperation. Everything else, you're going to have to decide or not will you make a stand, right? And let me say something. Everybody has something here. If you work for a company that was actively racist, you would have to make a decision, am I going to stay here? You might say, well, I'm going to stay here, but I'm staying here because I need, I disagree with them, but I'm staying here because I need the money. Well, you're immediate material cooperation with evil. Yeah, but I need the money. Okay, that's very good. But you can make a choice to not do evil so that good may come of it.
Does it depend, not only upon the situation, but the motivations of the problem?
Well, it does here, yes, absolutely. Because here, informal, you have to share the intention. If you don't share the intention, but you still do it, you're in the material.
Well,
So yeah.
He's using the example of the person with the company, because you could if you stay there to help better the company.
Okay.
Would that then be?
Well, that might throw you down here. There's a lot of circumstances, and you're right. You'd have to iron that out, okay? But maybe under some scenario, possibly, But it would depend on very particular circumstances.
What What about, like, you said if you're working for that company and then halfway through you find out that they are doing racist things, do you have to, like, quit that moment?
No, it's not like that. I mean, none of this stuff is done, it takes time to understand all of this. Like, if I work for a company and I found out they were doing something illicit, and you guys are, a lot of you are gonna have these experiences, you're gonna start trying to investigate. Let me give you a concrete example.
I have a quick question. What
Yeah.
is the one that you said is illicit?
Oh, remote immediate material. Are you guys following anything with the Little Sisters of the Poor and the contraception mandate from the Affordable Health Care Act? That's all based on this. So what the Obamacare or the Affordable Health Care Act is telling the sisters that because you are a religious affiliate, you do not get an exemption. You have to provide contraception, which could be an abortifacient to your employees. The nuns said, we're not doing it. The government says you have to do it. The nuns are fighting that now based on saying you are making us materially cooperate with the evil that goes against our conscience. That's what, and it just, the Supreme Court just did some action on that yesterday.
Wait, I thought only like churches and like religious. Oh, like wouldn't they be exempt from that? Like aren't
No,
they?
they're nonprofit. So they didn't fall under the, if you get into the Affordable Care Act, what determines what is and is not a religious
They don't
institution?
have to pay for it. They're not like that.
Well, that's what they want to say, but that's not what the government's saying. The government's saying, yes, you know, this, you're still, okay?